Hi, my name's Sam Harvey. I'm the Chief Psychiatrist at the Black Dog Institute and a clinical academic at the University of New South Wales. I want to talk today about what the ongoing COVID-19 pandemic means for the mental health of health professionals, and in particular, the mental health of doctors, and what that means for us as psychiatrists and what our role should be as we continue to move through these really difficult times. So, over a number of years, I've been running a research program based at UNSW and the Black Dog Institute looking at the mental health of doctors. And as I spoke about at the College Congress last year, there's still some really big unanswered questions around the mental health of doctors. We know a lot of junior and senior doctors do develop problems in their mental health. We're not immune from those problems. There's some debate around exactly what the level of risk is amongst doctors, but there's a couple of things that there's really no debate about. Firstly, we know that doctors have an unacceptably high rate of suicide. We also know that doctors find it particularly hard to ask for help when they need it. And the reasons for that are pretty easy to comprehend in terms of the ongoing stigma around mental health and the potential impact on people's careers. What we also can see very clearly is that COVID-19 is putting a lot of extra strain on doctors, regardless of where in the health system they work. We're seeing this come through very clearly in some of the international research coming from centres where COVID hit first, where there's a very marked spike in symptoms of psychological distress amongst doctors. And if we look at what happened in previous pandemics, like SARS and Ebola, where health professionals had to work in that situation for a long period of time, we can expect a substantial proportion to have ongoing mental health symptoms as a result of what they've experienced. We also know that what is particularly distressing doctors at the moment is having to work in a socially isolated way, not being able to be face-to-face with many of their colleagues, not being able to undertake a number of the consultations and procedures in the way they used to, having to wear PPE through them. For our colleagues who are actually on the front line in emergency departments and in intensive care units, we know a number of them are talking about the fear of becoming ill themselves or of bringing the virus home to their family. And these are stresses and strains that we expect to have as doctors. But what's really unprecedented is the consistency of it now over so many months, and we know that it's going to keep on going. So the question that all of this raises, I think, is what is the role for us as psychiatrists as this is going on? Because mental health is our business. So I think this is really the opportunity for us to step up and support our colleagues. And I've been really proud to see the leadership that the college has been showing in this regard and a number of initiatives that have begun. So I think there's 5 things that all psychiatrists should be doing at the moment. The first is I think we do need to be offering support and information locally to where we work. It's great that the college is producing videos like this, but we know that at every centre around the country where health professionals are struggling with these challenges, there is a local mental health service. Often it's a consultation liaison service that has the closest links to the general hospital. But regardless of who it is, I think somebody should be reaching out to the centres where we know that there will be a lot of distress, reaching out to the emergency department, to the intensive care unit, and asking, did they want one of our psychiatrists to come and do a presentation there to talk about what to expect, about how to handle these situations, what to do if somebody needs help. Which really brings me on to the second point. I think it's imperative that all of us understand what are the resources that are out there so that if we do have colleagues who we see are in trouble or who come to us for advice, we know where we can direct them. Many states have dedicated doctors' health advisory services or other services that we can use, it can be very hard to keep on top of all of them. So one of the things that the Black Dog Institute has done in partner with the college and with other agencies is to set up a central resource where people can go to get linked into whatever the local services are in their area. That's called TEN, T-E-N, which stands for the Essential Network. And if you're speaking to health professionals who are struggling or just wanting more information or some resources to help them, then you can direct them to that. There's a website or there's an app that they can download for free that will provide them with a range of resources that they can use, and it will also provide them with direct links to a national mental health service that's been set up for health professionals, or to some of these other existing services where they're available. So that's a one-stop shop that you can direct people to. The other resource that I think is really worth making sure we're all aware of is within the Find a Psychiatrist page on the college website, there is an option to be able to search by practitioners that will bulk bill other health professionals. So this is a way to make sure that if you've got a health professional who you're worried about, if they don't want to go through the TEN service, then you can direct them to that page. And of course, if you're a psychiatrist that would like to be on that list, then make sure you contact the college and update your details on that. I think thirdly, there's a real role for peer support here. We know that the best people to be supporting doctors are other doctors. And again, the college and some of the senior people in the college have done a great job in establishing some of these peer support networks or supporting them. The largest one is one called the Hand in Hand Network, which is run by a number of people closely involved in the college. And this is a great initiative where doctors can get trained to be able to provide peer support to other health professionals. So again, I think it's two things. It's number one, making sure you're aware of it so you can recommend it. And number two, if you're interested in getting involved, then reach out to the Hand in Hand Network and offer your support. I think fourthly, there's a real opportunity here for psychiatry. We know governments at all levels are acutely aware of the mental health impact of COVID. We see it being discussed regularly in the media. We see announcements from the government about additional initiatives or funding. And that's appropriate because we know that COVID is disproportionately affecting the marginalised and disadvantaged parts of society, and those with mental health are very much part of that. And so this is an opportunity for us to advocate jointly with a single voice around better funding for mental health services. Now that will vary on how we do it in different states and at different points of discussions and electoral cycles, but I think there's an opportunity for us to come together and make a really powerful argument about this being the moment where we have to get mental health services to have equality with other health services in terms of funding, resources, physical sites where it happens. And lastly, and I think perhaps most importantly, we need to make sure we're looking after ourselves during this time. While many of us won't be necessarily caring for people with COVID, although I know some psychiatrists will be, particularly consultation liaison psychiatrists. This is a difficult time for all of us and for our families, and we need to make sure we're looking after ourselves. I know John Allen in his video gave some advice about making sure that you take time out to look after yourself, making sure you know how to ask for help and that you reach out when you need it. So that's my views on where we are at the moment and what the role is for psychiatrists during this difficult time. I want to finish by thanking the college for the leadership that they've shown during this. I hope that we at the Black Dog Institute can continue to work with the college and with other psychiatrists around Australia as we try and put in place more support for our medical colleagues as they go through this. So stay safe and thank you.